But it seems that there is a sickness going around in hospitals that's affecting our medical frontliners. At ang tinutukoy ko po ay ang talamak na pambubuli sa mga ospital, sa mga first-year resident doctors, interns, and sometimes non-physician staff. It seems na may practice sa mga ospital na mga first-year residents, yung mga first year at second year, usually they experience bullying from their senior counterparts. Thank you. Thank you, Mr. Thank you, Mr. Chair. Good morning, Mr. Chair. And good morning to my fellow legislators in the House of Representatives, Congressman David Suarez, Congressman Albert Garcia, Congressman Juan Fidel Nograles, Congresswoman Maria Lucille Nava, Congressman Jose Francisco Benitez, Congresswoman Christine Alexi Tutor, Congressman Mujib S. Ataman, Congresswoman Ruth Hernandez, Congressman Florida Robes, Congressman Alfonso Umali, and Congressman G.P. Padiernos. And welcome to our resource persons and guests. Thank you for making time for today's hearing. Isa lang po ang tanong ko ngayong araw na ito. Paano po ba kung ang taong inaasahan mo magpapagaling sa iyo ay siya rin pong may sakit? Will he or she will be competent to give the optimal health care for their patients? Mr. Chair, alam po natin na pupunta po sa ospital ang mga tao dahil sila po ay may mga karamdaman. Karamdaman which could be physical injuries, illnesses, and other health concerns, or even mental health concerns. But it seems that there is a sickness going around in hospitals that's affecting our medical frontliners. At ang tinutukoy ko po ay ang talamak na pambubuli sa mga ospital, sa mga first-year resident doctors, interns, and sometimes non-physician staff. Marami na pong nakarating sa akin report na mga ganitong kalakaran sa iba't ibang ospital, private man o public, dito sa Metro Manila at sa iba pang lugar. Let me first lay down the basis. Mr. Chair, it seems na may practice sa mga ospital na mga first-year residents, yung mga first year at second year, usually they experience bullying from their senior counterparts. Ang sabi nila, ito daw ay practice na. At ito din naman ang kibit-balikat na sagot sa mga residents na ito na mga nakakatanda sa kanila tuwing sila'y umaalma. Ganyan lang talaga. Kailangan pagdaanan nyo rin. Pinagdaanan namin yan, matatapos din yan. Ano po ba kasi itong pambubuli na nangyari? Ang mas senior ay inaabuso ang mas junior sa kanila. Para bang initiation sa mga fraternity. Halimbawa na lang, pinambibili ng personal na gamit, merienda at pamalengke ng mga seniors. Bumibili ng grocery para sa pantry out of their own pockets. Sinusundo ang kanilang consultant sa bahay at hinahatid na para sila ay mga tsuper. Kaya minsan, ayaw umamin ng mga juniors, ng mga residents na ito, na marunong sila mag-drive. Pinag-babysit ng anak ng consultant. Pinapahiya, sinisigawan, nilalait in front of many people, including patients. Pinaglilinis ng CR. Pinagta-time in para sa consultant na hindi pa dumarating. Pinaglilinis pa ng kondo ng consultant. And I also remember, Mr. Chair, sa UST noon, may intern na na-rape ng senior resident matapos udyukan na sumama sa inuman. At ang mga eras na ito are done both during work hours instead of doing actual work for the hospital. And during personal hours, when the junior resident is supposed to take the rest. Mr. Chair, this toxic practice might have stemmed from a tradition where the senior residents or consultants intended to teach discipline, hard work, and grit to the neophyte doctors. Unfortunately, this tradition has gone out of hand and has gone beyond medical training. The duties being assigned are no longer medical related, going beyond the bounds of labor law, and are violations already of the code of ethics of medical practitioners, and frankly, it is no longer healthy. Ibang level na po ito. The toxic environment can no longer be ignored. Mr. Chair, I'm deeply concerned because apparently, dalawa na po na aking malabalitaan na residents na nag-commit po ng suicide sa isang public hospital, sikat na public hospital sa Quezon City. At isa pong resident sa isang public hospital sa Maynila. Bali, 3 na po ang nagpakamatay. Dahil stress, dahil palaging pinapahiya, dahil sila po ay depressed na. It seems that they were not able they were not able to handle the stress during the residency training. Kinaya po nilang stress sa pag-aaral ng medicine, pag-take the board exam at kung ano pa. They already have what it takes. But what broke them is the toxic environment during their residency. While I'm sure that this is not true for all circumstances, there are too many reports that have reached me to say that this is an isolated case. We have to protect our medical frontliners by helping them to work in a healthy environment. The nature of their work is highly stressful already. Dapat di na nagdadagdagan pa. Kasi po, Mr. Chair, napapasa po nila itong stress na ito sa kanilang mga pasyente. Siyempre, pag stress po ang mga resident doctors, yan po ay napapasa sa kanilang mga pasyente. Matatandaan ko po, Mr. Chair, hindi ko na mabilang ang mga pasyente pupunta sa akin, nagreklamo dahil ang suplado ra po ng mga doktor, lalo sa mga public hospitals, nakasimangot, naninigaw. Malaman lamang ko, those are resident doctors. Siguro, sila po ay nakararanas ng pambubuli. Sila po ay sinisigawan. Pinapahiya ng kanilang mga seniors, kaya nagkakaroon po ng chain reaction. Pagdating nila sa harap ng mga pasyente, kagagaling nang sila sinigawan ng kanilang seniors, ipapasa po sa mga pasyente, maninigaw din po sa mga pasyente. Yan po ang nangyari madalas na isinusumbong sa akin, mga resident doctors, especially itong mga bagito, naninigaw daw. Ibig sabihin, yun po ay chain reaction lamang doon sa mga nangyari sa kanila mula sa kanilang seniors. Mr. Chair, since the tradition is something coming from above, those from above the hospital hierarchy must take responsibility. The chair of each department exercises supervision and control over those beneath them. I am sure alam nila ito ang kalakaran na ito. They should lay down standards within their department. Number 2, the hospital administration must also work with them to provide a policy for the entire hospital where bullying is not to be tolerated. The hospital administrator, including the board, must take care of their people. Number 3, the DOH, as the regulating department agency, must ensure that all hospitals have fixed guidelines in the implementation of the residency training, and there must be strict implementation of this. Also, the DOH must continue to supervise both public and private hospitals. There are instances where the selections of the heads of the LGU hospitals are left to the discretion of the local government unit. The DOH must make sure that those running the hospitals are capable of maintaining a healthy, efficient, and professional workplace for our doctors. Hindi pwedeng padri-padrino kung sino ang nagiging hospital administrators kasi kung hindi, walang gagawin mga yan para ayusin ang mga problema sa hospital. The Professional Regulation Commission has the power to discipline our physicians. They are tasked to make sure that our doctors comply with their code of ethics. Pero ang balita ko po, ang mga disciplinary cases sa PRC ay napakabagal daw po gumalaw, parang pagong. Ang mga kasong napafile ay doon lang nagtatapos dahil nainip na din ang mga party sa tagal. Meron pa akong mga balita na nag-file ng complaint ng isang resident doctor's first year, nakapag-graduate na siya and all, naging surgeon na siya, hindi pa natatapos yung kanyang complaint. All pa sudden, pa-abroad na siya, saka palang dumating at na-actionan yung kanyang reklamo. Ganun na po kabagal ang pag-file ng kaso sa PRC. At yan po naman ay sinangayunan ng ilang pang mga nakausap ko na mga complainant. Kung meron man minsan inaabot daw 10 taon, yan na po sinasabi ko. Suggested action. Mr. Chair, I want to see that this practice stops. Pero mahirap po dito, gaya sa lahat ng forms of bullying, walang nagsusumbong. Takot magsalita ang mga tao dahil itong mga biktima will still continue to work in their industry. They do not want to burn bridges and be branded as difficult to work with. And so, let me say it out loud for them. Ayusin po natin ito. First, I hope that there will be guidelines and rules for the residency training in hospitals. There must be mechanism for this to be implemented strictly. Second, I want strengthened grievance machinery in hospitals. Hindi yung sa papel lang may grievance machinery. The employees of hospital must be comfortable and must feel safe when they run to these grievance machineries. Third, I implore upon PRC to look into the disciplinary procedure of our doctors. In this line, let me raise my concern in my other resolutions. Kasama po sa pag-improve ng health service natin is to infuse support for hospitals through the universal health care. I would like to ask PhilHealth regarding the implementation of the rating system of health facilities in Section 27 of the Universal Health Care Act. There is a provision requiring PhilHealth to establish a rating system under the incentive scheme to acknowledge and reward health facilities that provide better service, efficiency, and equity. That's all, Mr. Chair. Maraming salamat po.
Salamat, Senator Raffy Tulfo. Ang puso mo, sir, ha? Birthday mo pa naman ngayon.
Thank you, Mr. Chair.
Salamat, Senator Raffy. Pwede